Hi, my name's Associate Professor Amy McCart and I'm a breast cancer researcher here at UQ's Centre for Clinical Research. I've always been a curious person. From my early childhood, I wanted to know everything about biology, how things work, how they grow. And through my high school years and into undergraduate, I really started to be interested in cancer and the basis of a disease that you tell someone they have before they're really sick, and then the therapy that you give them makes them sick. And it's really puzzled me, and really wanted to use DNA-based technologies to try to understand what makes cells do this to people. So we talk about breast cancer like it's one disease, but it's actually hundreds of different diseases depending on how we categorize it. For a couple of areas of my research, things are really looking good at the moment. In particular, the work that my colleagues and I are doing on lobular breast cancer, where we're working on a specific test that can help us to determine whether or not the patient will have a good outcome from their disease. So this will give us the opportunity to do a test in the pathology labs at the time of diagnosis and let us know whether this patient is likely to do well, regardless of if we give them chemotherapies. And we can therefore strategize which patients need more intensive treatment and more close surveillance and monitoring over time. And the other part of our research is really looking to understand another special type of breast cancer called metaplastic breast cancer. And we're working to understand why this particular cancer type can show many different cell types within the one tumour. So it's a really unique type of cancer, and we're trying to understand what's pushing it to have this really particular and characteristic look. It's a really great potential to have a huge impact in the healthcare system. If we're really individualising therapy and only giving people the drugs that they need, then we're reducing the cost of drugs that we're giving just in case it might work. We're also, by only giving patients drugs that will work, reducing the number of people who are having awful side effects for no real benefit, which reduces the number of inpatients in the hospital day to day. With the kind of research that we're doing here, we have the capacity to change people's lives. Ultimately, the goal of curing cancer may or may not happen, but we can change people's day-to-day lives in terms of the idea that the therapies that we can give people may not come with debilitating side effects. If we can target the right drugs to the right patients in this precision oncology idea, we can really individualise treatment.